Hi, I am Delusion Dispeller, and I am here today to talk to you about a type of therapy that is very different than a lot of typical therapies of today, and it's relatively new. I first had an interest in this therapy about a year or two ago when I was learning about behavioral disorders and personality disorders. It's very interesting how this therapy came to be, and this therapy is becoming more and more used, more often used in today's day and age than it was back in the 1970s when it was first discovered. I think it's important to talk about this therapy because it is one that I recommend, especially to people that have disorders that are not responding to typical therapy treatments, which is how this came about. I will explain to you exactly what I mean by this. Okay. Let me get to my page here. Alright, the name of this therapy is Dialectic Behavioral Therapy, otherwise known as DBT. First of all, Dialectic Behavioral Therapy was discovered by Marsha Linehan back in the 1970s. The reason why this was discovered was because Mrs. Linehan, or maybe it was Miss Linehan, I'm not sure. We will say Miss Linehan for all intents and purposes of me not knowing her actual circumstances, marital or otherwise. She had some clients that were coming to her with some very rough problems. They were cutters, they were self-mutilators, self-harmers. A lot of them had suicidal thoughts and had even tried to commit suicide. Miss Linehan had been using something called cognitive behavioral therapy. And the premise of cognitive behavioral therapy is largely that your thoughts control your actions, while your thoughts control your feelings that lead your actions. The reason I know this is because I have been visiting a cognitive therapist with my fiance for about almost going on a year. So I know how cognitive behavioral therapy works. It basically teaches you to change the way you think about things, and thus you're able to control your circumstances a little bit more based on how you react to them. Okay, well, this type of therapy, cognitive behavior therapy, was working with some patients, but with the patients or clients that Ms. Linehan had, many of them it was not working with. And we'll get a little bit more into detail on what that means in just a moment. She wanted to find out if she took these clients that had been very wounded in their past, very traumatized, to the point of where they wanted to die, if she could use this cognitive behavioral therapy to help them with these problems. Well, what she was finding out was that this type of therapy was not working with many of them, because many of these clients had something called borderline personality disorder, which means they experience emotions very intensely, even more so than normal people would with normal typical problems. And this therapy was making them feel invalidated. So she needed to find out exactly what was going on, why this particular therapy was failing with so many of these clients. Well, the first problem was that when you tell somebody, well, you need to change your thoughts, just think differently. These clients, many of them had learned something called a defense mechanism, something where they would react in a certain way so as to not experience the deep inner pain that they did not know how to express and did not know how to handle. So when these clients were told, well, just change the way you think, it's all in how you think about things, well, their thinking was distorted. So instead of feeling like, oh yes, if I just change my mind, everything will be okay, they felt like they were doing something wrong. They were being attacked. They were feeling put down, ashamed. Some of them even felt very angry, and many of them were leaving treatment before they got the help that they needed. This obviously was not a good thing, because that's the whole point of therapy, is to help the client. Another thing is these clients felt that it was okay to both punish and reward the therapist based on how the session went. In other words, if the therapist had hit on a certain topic the client was uncomfortable with, and the client could do something or say something or act a certain way to make the therapist divert onto a different topic, then the client would warm up to the therapist, talk nicely to her, and cooperate. However, if the therapist stayed on a topic the client did not want to be on, the client could manipulate the therapist by becoming angry, refusing to talk, saying mean things, or any number of reactions to get the therapist to feel punished by not allowing the client to control the topic of the session. The third reason that cognitive behavioral therapy did not work, and the other typical therapies, was that therapists needed enough time to teach these clients, and all clients, skills that would help them make other decisions in their life that would be more, a healthier decision, and things that would help them feel happier with their life. Well, they didn't have enough time to work on life skills and handle some of these other issues that were coming up, such as cutting, suicide attempts, maybe even murderous thoughts towards their abusers, those types of things. There just wasn't enough time in a session to handle all those things. So cognitive behavioral therapy was not working very well for these types of clients. Therefore, there needed to be a change of some kind made in therapy that would specifically deal with people that had these extreme types of issues. Okay, so along with cognitive behavioral therapy, Linehan discovered that if you validated these clients and gave them acceptance, that they responded a lot better. This would help the client because during the process of being accepted and validated, the client was learning to trust themselves, was learning to examine their own behaviors and notice which behaviors yielded positive results versus negative ones. And they began to understand that it was okay to express that they cut themselves, that they burned themselves, that they were self-harmers, self-wounders, self-mutilators, and that they had these suicidal thoughts, and that they would not be condemned for them. Therapists were trained to basically listen to the client and validate them and make them understand that it's okay to be open. It's a safe place to share whatever is on your mind in whatever form that you want to share it, as long as you are feeling that I'm listening to you and you're going to open up. It will be a good client-therapist type of relationship. Clients seem to respond very well to this. And along with all of these other things, the therapist was also trained not only to teach the client what behaviors to recognize that were harmful, but also to validate and encourage them when the client showed a behavior that was normal. I thought this was fascinating myself because I guess it had never occurred to me that these clients not only need to be pointed in the right direction and told, when you cut yourself, you might cut a vein and kill yourself, or when you get angry, you might lose your temper and really hurt somebody. But also when that client comes into therapy and says, well, my boyfriend hit me today and I got really angry and I felt guilty about being angry, for that therapist to be able to say, you know what, you had a reason to feel angry, and that boyfriend hitting you is not an okay thing. Your behaviors and your reactions were normal in that situation. You're being harmed. It's okay to respond in a normal way, that you became upset and didn't like it. It's not a good idea to feel shame because you have nothing to be ashamed of. It's wonderful to hear that there are therapies out there that are actually validating clients for how they feel and also addressing both the harmful and the helpful behaviors. Stay tuned and I will go on more about dialectic behavioral therapy. And thank you for tuning in. I hope you are able to understand clearly what this is all about, and perhaps if you or somebody you love needs this kind of help, you can get it. Thank you. I will be right back.